Good morning, good afternoon, everyone. My name is Susan, and welcome to our broadcast. I'll be your host today. I'm Susan, the Executive Director of Real Estate Operations with the Providence Real Estate Group. As a reminder, the information provided during this event is for informational purposes only. For medical questions, please reach out to your primary care or healthcare professional. Now let's begin. Joining me during this live event will be Clay Silik, Manager of Engineering at Providence St. Peter Hospital in Olympia, Washington. Also, Jeff Glass, our Senior Technical Program Manager of Energy for all of Providence. And finally, Michael Navsgar, Manager of Facilities at Providence Sacred Heart Medical Center in Spokane. This week, we want to celebrate and highlight National Healthcare Facility and Engineering Week, and it's only appropriate to highlight the essential work of these caregivers to keep our facilities running efficiently, as well as all of the efforts they put forth meeting Providence's commitment to become carbon neutral by 2030. So let's meet the group. Tell us a little bit about yourself. How long have you been in facility? How many square feet do you and your team currently manage, and what's your oldest facility?
Well, I have been in facilities now for 4 years. 2 years here with Sacred Heart Medical Center. My building square footage that I have is approximately 1.7 million square feet, but including parking garages, we're at 2.8 million square feet. Our oldest building that we have dates all the way back to 1946.
Wow, that's great. That's great. Okay, Clay, same questions to you. How long have you been working in facility engineering? What's your oldest building, and how many square feet do you and your team currently manage?
Thank you, Susan. Well, I'm over that 30-year mark now. That's for the highly reliable organizations. That's a 3-0. And then we have right now, currently, I'm responsible for about 750,000 square feet. And the oldest part of our facility dates back to 1969.
Very nice. And Jeff, last but not least, tell us a little bit about how long you've been working in facility engineering. What amount of square footage do you work with at Providence now? And what's your oldest, well, maybe what's the oldest building you're familiar with in the Providence system?
Good afternoon, everybody. Yeah, I've been working in facility management for 40 years now at 4 large hospitals in Western Washington. And I'm responsible for advising on environmental stewardship initiatives, especially related to the built environment across the Providence enterprise, which includes about 79 million square feet. I guess I could answer the building that I'm familiar with having managed that's the oldest, dated back to 1910.
Wow, that's excellent. So as you can imagine, we have some interesting challenges in the healthcare industry with our buildings. So Clay, quick overview of what is facilities and engineering, what is the basic scope of what our teams work on?
Well, Susan, I like to describe it as that we are part of what we call the healthcare environment of care. Think of a patient surrounded by a protective bubble that provides comfort, safety, security. And when we do this optimally, it provides care, treatment, and healing, especially for those who are incapable of self-preservation. But this also applies to visitors and staff. It's more than just mechanical, electrical, and plumbing, as we are part of an overall support service. How things look and feel, that's on us. I think of a hospital as a micro city that is highly regulated at federal, state, local levels. In larger facilities, there are many participants in its environment of care, but in smaller ones, the facilities person wears multiple hats. The ever-changing world of healthcare requires us to what I call flexecute, and I adopted that idea early in my career. We're constantly trying to understand the requests of our customers in order to bring solutions, perhaps in ways they have not thought of previously.
Excellent, thank you. Now, as we are 2 days away from Halloween, I thought we might kick it off with a fun question, a little bit of what's the scariest experience you've had as a facility leader within one of our facilities? Jeff, you want to kick it off?
Well, as I said, I've been doing this for 40 years, so I've had many, but the one that I picked is this story. It was October 28th, 2005 on a Friday evening about 11:30 at night when I was woken by a call from the hospital operator. Mr. Glass, a medical airlift helicopter has flown into the side of the hospital and administration needs you there immediately. Imagine what you would be running through your head as you were called to work under these circumstances. Turns out that a medevac helicopter had caught one of its skids on a parapet wall on the roof of the hospital upon takeoff and had crashed 2 stories to the ground with 3 crew. Thankfully, injuries were limited. The kicker was that the crash occurred about 15 feet away from the hospital's main boiler plant. A few feet more and the plant would have been taken out of commission, likely resulting in long-term hospital evacuation. We worked day and night with the FAA to ensure safety and help them evaluate the reason for the crash, then cleaned up the crash site for work the next week to heal the psyche of those who experienced the crash as soon as we possibly could. Later, 2 nurses were overheard saying, "Isn't it amazing that the helicopter crashed and didn't even damage the landscaping?" This is facility management excellence.
That's great. That's great. Okay, Michael, what's your scariest experience?
Well, I haven't had anything like a helicopter crash, but in my 2 years here at Sacred Heart, I would say my biggest one that was scary was our 10-inch sewer main out of the building backed up. So imagine what damage a 10-inch sewer main can do to you.
Sadly, I think I can imagine that. Yes, that's great. Okay, Clay, what about you?
Well, I thought back to March 26, the year 2000, and that was the day that the Seattle Kingdome was reduced to a dust-choked pile of rubble. And that dust cloud made its way over Interstate 5 and up the hill from Breezes off the Bay to pass over our Level 1 Trauma Center. It was thick and it sent us scrambling to minimize outside air intake. But we really weren't prepared for what happened in what seemed like minutes, but fortunately there weren't any negative outcomes.
Wow, seeing that coming. I remember that day, actually. Okay, let's talk a little bit about what you and your teams deal with on a daily basis. Michael, what's the most challenging thing you and your teams deal with on a regular basis?
Susan, I probably would say right now for us is the work orders and how they describe what the issue is. Realistically, we're trying to determine what they're asking for, but we're finding out that their terminology is definitely different than our terminology. So sometimes that slows us down to where we don't always get to it right away.
That's excellent. Yeah, it's kind of like how I describe what the noises my car is making when something's wrong with it. Is that how that works? Well, let's continue with that, Michael. So, as you know, Providence has set a goal for becoming carbon negative by 2030, which is a big and challenging goal. And a significant portion of that will fall to our facility engineering teams to address over the next 10 years. Tell me about what your team and what the broader facilities team will focus on over the next few years.
Wow, this 2030 is a great goal. My thought on this is looking at the training of the staff and what they need to understand. Really, the why. Why do we have these energy efficiencies? What's what we have to do to maintain this goal, to keep it up, but training of the staff so they know exactly how to operate the equipment and not adjust something out of tolerance.
Excellent. And Jeff, you have a broader role of supporting this effort across the entire system. What are some key considerations that you and your team have identified to really help us reach this goal?
Oh, I think first and foremost, we have to look at this as a cultural evolution for our facility leaders. And I'd submit included with those leaders is everybody on our teams. This is something that really needs to be pulled forward by everybody who works for Providence. And we all need to be engaged in this goal by thinking strategically about how we can consider the environmental impacts in all the facility decisions that we make, including dramatic improving energy and water efficiency and reducing waste generated by our operations, moving to clean, renewable sources of energy, and making our buildings operate in a more intelligent manner through sensors and computer automation, kind of like that Nest thermostat you may have recently put in your home.
Excellent, excellent. And Clay, in your experience as a facility manager, what projects have you been able to implement that address energy efficiency?
Well, they've been both large and small, and seems like everywhere between, from millions of dollars to thousands. But what I found is common to all of these is your utility data, typically based on what meters are turning. And there was a time when I paid every individual utility bill for 6 hospitals and about 225 clinics. And without being able to visit necessarily every location, I could glean a lot of information about what was going on. Upon implementing an automated process, it became easier then to apply analytics and allow the data to help drive decisions not only around the cost of doing business, but where to apply efforts around energy efficiencies, including reductions. I look forward to participating in the 2030 goal with Providence and applying this as well.
Jeff, tell us about one of the most exciting energy projects you've been able to work with while being at Providence.
Well, when I thought about this question, Susan, I thought about the one that made me the most proud of having accomplished, and that's again back to this cultural change, building a really strong culture of environmental stewardship and associated pride that came with that, with the team at Providence St. Peter Hospital in the Southwest Washington service area. One of the projects that the staff developed at St. Peter Hospital was to use the building automation system to predict hot and cold problems in clinical areas and report to our facility staff before the patients or the clinical staff would experience the temperature problem. This initiative resulted in the hospital being designated as the smartest building in America by Siemens Corporation in 2015. And it was the team at the hospital that developed that application and submitted all the supporting documentation to win that award. I'm very proud of their work and all the work that has taken place at that hospital over decades period of time.
That's fantastic and a great example of how it can achieve our kind of energy goals, but also patient comfort and staff comfort. I think it's so great when those are able to connect. Michael, tell me about an impactful project that you and your team have done related to energy efficiency.
Susan, one of our big projects that we've done here recently, we completely did an overhaul of our chiller plant. We went from 3 basically non-variable speed chillers to 4 magnetic bearing chillers. This really allowed us to give us the speeds that we need of the chiller or to run the speeds of the chillers that we need to make sure that we match the actual building load that we have. This was a huge cost reduction. We didn't have any, we reduced, I should say, our demand charges on our electricity bill because we no longer had that 0 to 100% run of our chillers. Now we could start as low as 5% of our chiller usage and move all the way up to 100%.
Wow, that's excellent. Thank you. So Clay, question for you. What advice would you give to a facility engineering leader who's just kicking off an energy management program or an environmental stewardship effort at their facility?
Yeah, several things come to mind here. Obviously, in advance, do the homework. You want to make sure that how the effort's going to pay off. But start small. Don't try to feel like you have to take on the big guns, but it's important to start and not take every advantage of every opportunity. I would also look for grants and rebates that are available. Oftentimes they're because you do the drill down is how you find them. And then some projects have returns that are not necessarily high cost, as their lever is around human behavior and how that can be changed and implemented. I would also recommend that you have a place at the table. I was able to be part of a greenfield hospital build, probably the project of my career. And we put a lot of effort into design, and it resulted in that hospital being the first LEED Gold hospital in the state of Washington.
Excellent. So going off on the topic of partnering and local grants and funding, Jeff, would you tell us a little bit about the solar project that you worked on in the Washington area?
Oh, sure. Yeah. Very, very proud of that project. This was for our hospital in Centralia, Washington, which is just south of Olympia. And in 2018, we were able to receive a grant from the local coal plant that was scheduled to close, or is scheduled to close in the next couple of years. It was a grant for 100% of the funding for a solar photovoltaic system on the roof of Centralia Hospital. And that project just was wrapped up here early this fall, and it's now, as we say, harvesting photons of the sun's electricity. So the community is very proud of that work, and we're glad to have the environmental, financial benefit, and certainly for the support of our local business, TransAlta, and through our local foundation in Southwest Washington.
That's excellent. Thank you for sharing that. Okay, Michael, question to you. What advice would you give to a facility leader who's embarking on the energy or environmental stewardship effort?
Oh, a lot along what Clay had said, and don't look at the big picture of everything. For us on a 1.7 square foot building, a million square foot building, if you try and look at the whole building as a piece, boy, that really would make it difficult. Break it into smaller components, down to your lighting, down to snow melt, down to your chiller system, your air handler system. Break it down that way into smaller components so it doesn't seem so daunting.
Excellent, thank you. And Jeff, your thoughts as well. For someone running a facility, whether it's healthcare or not, what would be your first steps to kick in?
Well, I would start by acknowledging that the team that work in these facilities 24/7 probably know the way the buildings run better than the management or leadership, likely. So I would start with a very simple thing, and that is to ask them what their ideas are and encourage them to keep their eyes, ears, and noses open to inefficient practices and operations, to report those and to recommend solutions for those inefficient operations. I coined a term, a penny a gallon. Whenever I saw a drain leaking water, to me that equated to about a cent for us to pay for that gallon and dispose of it. So they are our eyes, ears, and most importantly minds, working in the facility and are familiar with facility operation. After that, I would encourage everybody to think strategically in the true RESO spirit, with an eye towards energy management and environmental stewardship in every decision that we make. That, like Clay and Mike said, no improvement is too small, because they all add up to stewardship benefits for Providence now and in the future.
That's excellent. And actually, we had a question come in the chat, Jeff, and I'll stay with you on this one because I know it's a big passion for yours. For those who might be listening that don't run a hospital or don't run a facility, but want to make an impact environmentally and kind of partner with some of the things we're doing in the hospital, what recommendations should they use to start with at home? Oh,
okay. Wow. So really the things that we've talked about here in terms of energy efficiency and waste optimization and waste reduction apply equally or maybe even more beneficially if we consider how many homes there are in the country. But but yeah, you may very well have access to somebody that can help you with an energy audit to identify energy conservation measures in your home, or you may have a public utility that can help you with optimizing your waste streams, so you segregate recycling and yard and food waste from your solid waste. But those would be some of the suggestions that I would have. Another big source of environmental impact for our operations is transportation, and that is in both our business travel and in our own commuting behaviors. So thinking of alternative forms of transportation to get to and from work, or to do your work, especially short runs around town and such, are big impacts on benefiting the environment.
Excellent, excellent. I want to ask a question around the data. All of you have mentioned data tracking and data management as a really powerful tool in managing environmental stewardship and facility engineering, to be clear. Jeff, I know that the system has put in a lot of effort around data tracking within Providence. Can you tell us a little bit about the efforts that have been made for that, and what it's been able to provide to us?
Absolutely, yeah. We are blessed. Providence understands, I think, the power of data and the importance to make good decisions. So we have had a strong data platform for energy, water, and now recently for waste for probably about 10 years. And our current system for that and for processing all of those invoices is a product called Resource Advisor. And that is an excellent database for helping us to aggregate our utility consumption and expense and see that in a web-based platform. We are evolving that platform, using that as a foundation through Power BI and a partnership with our internal information systems leadership and Microsoft to build a data analytics means to allow us to have visibility on benchmarking facilities and understanding the efficient performers from less efficient opportunities in our system. And that is a project that's the first phase of which is just getting completed now, and we're very excited about long term that being the way that we're able to track on a regular basis our carbon emissions and work towards that carbon negative goal by 2030. If we don't have data to track that, we really don't have a chance of meeting that goal. So a lot of energy and effort has been put into that, but it's been built on over a decade of strong leadership in tracking this data.
Clay, you mentioned earlier in your answer being at the table when planning these initiatives or planning these efforts. Tell us a little bit about who some of the other partners are in your facility and in your hospital that you work with on environmental stewardship.
Well, definitely one thing I don't expect necessarily our listeners to understand is that we have a whole division that really brings together the components necessary for putting into information into a project, whether it be design or along the way. And I like one of the hats that facilities needs to wear is that one that reviews or looks at or participates in design decisions. And I think what's good now is that Providence is able to apply these sustainability goals to those decisions is one thing. Also, we have, as Jeff mentioned, talented people in our buildings that you might be able to have them at the table or review a proposal, and if the first words out of their mouth is, well, that's not going to work, then it's an opportunity to understand why. And so it's a matter of helping and collaborating with our project management groups, and whatever is built, facilities inherits. So as best we can, amongst other priorities, to be out front and review is one of the best things that I could recommend. It also gets you familiar with, even if it's just on paper, what's coming. And a lot of the principles, it doesn't matter if it's large or small project, it's the same. And so it's how to keep a lookout for those things. And a lot of times we don't always get what we would like, but at least we can pitch the effort. And that's, I think,
Excellent. Thank you.
You don't get what you like, but you get what you need, right, Clay?
yeah, there's a difference between wants and needs, that's for sure.
Exactly. Jeff, just highlighting one item, when a facility is kicking off, a program and really trying to evaluate where to start, many of you, Michael, talked a little bit about kind of breaking it into smaller chunks and being able to, not having to bite off everything at first. We've used the energy audit as a tool to really kind of identify that. From a simple perspective, what are the key components of an energy audit?
Really, it's again back to the data. It's looking at historical data to really understand where you are, where you compare. Fortunately for Providence, we have 53 hospitals that we can look at the data in quite some depth and understand who's doing a really good job and what are they doing to do that job really well, and how can we share that information with others. So that's part of an auditing process. But there is the ability now to model buildings and understand energy flow in buildings, and then to submeter or within our building automation system, understand and model how the energy is flowing in our buildings to determine where we can optimize, where we can make those buildings as efficient as possible given their original design, or even modifying that design. So that's kind of how I would describe an energy audit. But the idea is that it's to identify cost-effective energy efficiency measures that then can be pursued to achieve these environmental stewardship benefits.
And just one last question before we wrap up. I know we're running out of time here, but a question's come in from the chat of, are all the hospitals within Providence participating in the goal, and does it extend past our hospitals into our clinics and non-acute facilities?
Yes and yes.
Excellent. Thank you, Jeff. Okay, well, it's time for us to wrap up, but I just want to thank you, Clay, Michael, and Jeff, for joining us today, and all of you that are watching. It's really helpful to us to have these conversations, and I want to recognize our facilities and engineering teams and thank them for all the work that they do each day to maintain our facilities and to support Providence as a mission-driven organization. And really excited to see where they take things on our energy stewardship goal. To learn more about our initiatives, programs, services, or ways to give, or if you're looking for medical care, please visit providence.org. And make sure to follow us on social media, Providence Health System for LinkedIn, Facebook, and Instagram, and @Providence on Twitter. Thank you so much for joining us today.